Hi everyone, this is Divya from Quickmommyhacks, and today we are going to talk about teething in babies. And for this, we have Dr. Anamaya. She's a pediatric dentist and she practices in Mumbai. She also specializes in myofunctional therapy for children.
Hi Anamaya, how are you? Thank you for coming here to talk about teething in babies.
Thank you so much for having me, Divya.
Yeah, so I guess about this issue, the first question would be what is exactly teething?
So teething, people relate teething to a discomfort or a difficult time for the children, but actually teething just means eruption of teeth outside of the gums. But just because every time most of the children go through difficult times, so they relate teething to painful crankiness and a hard time for kids. But teething can just be called as eruption of milk teeth in the oral cavity.
So when do exactly babies start teething?
Teething will usually the teeth erupt, the first tooth in the child will erupt from any time from after 4 months of age. So usually by 6, most of the kids should have their tooth to be starting to erupt. So if the child is getting a tooth, say at about 6 months of age, so then the difficulty or the crankiness will begin maybe 15 to 20 days before that. But the very difficult time when the child doesn't eat and all is just for about 7 to 10 days, when the
Okay.
tooth is absolutely at the edge of the gums to be out in the mouth.
So what are the signs and symptoms of teething?
So the basic and the first sign of teething is pain, uh, it's swelling of the gum, and the gum starts becoming red. And there can be slight bleeding, because what happens because of all this is the child wants to put each and everything possible in the oral cavity.
Hmm.
It kind of gives them an itching sensation. So they want to put their fingers or whatever they can get hold of and they can grip it, they want to put it in the mouth. So that is exactly what happens. So because of the pain and the swelling and the redness, the fever comes.
Okay.
And because of all this, because they put each and everything that they can
Hmm.
grip up to into their mouth, the loose motions start.
Okay.
So the
Hmm.
basic signs of teething are just plain and swelling of the gums, redness
Okay.
and swelling of the gums.
So do they always get fever, diarrhea, and vomiting while they're teething?
No, they do not always get that, and they are not the basic signs of teething. But what happens is when the child begins to start teething, and there's just some amount of pain and swelling, the parents don't really notice till the child
Hmm.
starts showing symptoms of not having food, not wanting to have breast milk, because they start having an immense amount of pain. And the first
Yeah.
teeth that erupt are the lower incisors here. So
Hmm.
when they grip onto the breast for breast milk, they cannot do that because of the pain and
Okay.
the swelling. So
Hmm.
that is when the child starts losing weight. That is when the child, because of not consuming food, at the same time eating each and everything that they can grip up to, starts
Hmm.
getting fever and loose motions.
Okay.
So pain, so fever and inflammation are not, and the diarrhea are not the basic signs of teething.
Okay.
In fact, they
So,
are adjunct to all this. So there are
mhm.
lots of kids who do not even get those symptoms.
Okay. So what is the order of tooth eruption?
So the first, so in a primary teeth sector, there are 5 types of teeth that the child will get. So the first teeth to erupt are the lower incisors, central
Hmm.
incisors, which should start by any time from 4 to 6 months, 4 to 9 months.
Hmm.
Actually, it varies.
Hmm.
Sometimes they have an early. Ideal time is 6 months, but a range of 4 to 9 goes away. So then
Hmm.
the lower incisors, central incisors, followed by the upper central incisors, then the lower lateral incisors, the upper
Hmm.
laterals. Then there is a gap of say 2-3 months when then nothing really happens, and then the molars
Okay.
and the canines erupt. So
Hmm.
there's a rule which says every 6 months, once the first tooth erupts, a child you will see 4 new teeth in a child's mouth.
Okay. Okay.
So but it begins with the lower central incisors, and that
Hmm.
is when the child suffers the most, because that's the first time of a kind of exposure for the gums for something erupting and cutting through the gums and coming out.
Hmm.
Later on, the effects of teething usually come down.
Yeah, actually, that's really good to know. So
Yeah.
another question is basically like how long does this teething process last?
The absolute teething process when the tooth is coming out should just be about 10 to 12 days.
Hmm.
But what happens is there are a lot of factors involved, so we cannot say that it is going to end in 10 to 12 days. It can just be, it again, some kids just show it for 3-4 days, some show it for
Hmm.
even more than 20 days, because that all depends on the age and the time at which a tooth is erupting. It depends
Okay.
on the thickness of the gum of the child. Now these factors we cannot really control from our side.
Hmm.
So, but if the ideal and the perfect tooth teething time when the tooth is coming out is 10 to 12 days. It
Mm-hmm.
stops the minute the parent can see a whitish tooth cusp coming out of the gum.
So usually, parents around when the kid is around the age of 5 to 8 months, they often blame teething, as for colic and for crankiness.
Yeah,
So
yeah.
is that the right thing?
So, no, that's not the right thing. What happens at that time is still about 5 to 6 months, the child is exclusively breastfeeding. Till about 6 months or 7 months. After that, the parents start introducing the child to something solid, something mashed, anything but not other than breast milk. At the same time, what happens is the child is developing his or her own innate immunity. Till
Mm-hmm.
then, the child is completely protected by the mother's antibodies. So there's a
Okay.
major change happening in the child's body by the development of self immunity complexes
Mm-hmm.
that are happening. At the same time, they introduce something other than breast milk.
Mm-hmm.
So the digestive system kind of gets the load for the first time. Till then, they just had to
Yeah.
work on digesting the breast milk.
Mm-hmm.
Anything, even if it's just a mashed banana or a mashed mixture of puree of vegetables, but it's something new for the child. It's not something that the child has ever had. So the
Yeah.
digestive system also gets a load, and hence the colic, hence
Mm-hmm.
the constipation or the colic, all that happens. At the same time, the child is developing his or her own immunity apart from the mother's immunity. They need to
Okay.
get off the mother's immunity. So that's a very big development that's happening in the child.
Mm-hmm.
Also, what happens is at the age of 3 to say 4 or 5 months, the children start developing the salivary glands.
Mm-hmm.
So if you see in teething, parents complain that the child is drooling, is
Yeah.
crying, is
Mm-hmm.
coughing. It's
Yeah.
not only because of teething. In fact, it's a very minor effect of teething. It is not
Okay.
something very major for the teething. The reason
Mm-hmm.
that happens is at the age of 3 to 4, 3 to 5 months, they start developing the salivary glands. So the
Yeah.
body starts making more saliva. But
Okay.
the salivary gland is so developed that it cannot hold the saliva. So it drools.
Okay. Mm-hmm.
They make the saliva but can't hold it. So the drooling happens. So again, it happens at the time when the child is teething. So
Mm-hmm.
sadly, all the things are blamed on teething, but there's a lot more and important things that's happening in the child because of which, colic and drooling and hence the crankiness, hence the cough happens.
Okay. No,
Yeah.
that's actually really interesting to know. So, so
Yeah.
what are the best ways to soothe, those sore gums?
So anything cold that the child can be given to hold by himself or herself, or the parent can. So usually what is recommended is a frozen washcloth or a frozen gauze, clean gauze or a washcloth that's frozen in the freezer. Parent puts it
Mm-hmm.
around the finger and puts it on the child's gums just
Okay.
to soothe the child. Or
Mm-hmm.
a clean teething toys that are frozen, that are favorite toy. So because the children are anyway putting everything in the mouth.
Mm-hmm.
So they rather be given the toys that they like and they can just chew on them. Now,
Mm-hmm.
what is a good thing when the child teeths for the first time is they are these deep, this
Yeah.
area.
Mm-hmm.
So they don't even have to put it inside in the mouth. They're just going to hold it there. So
Yeah.
anything and
Yeah.
everything they put in the mouth is going to soothe them, give them comfort. So
Mm-hmm.
soothing, to the cold frozen toys. Then there are these teething things wherein you can put the mashed food in it.
Mm-hmm.
So it kind of works to introduce to the child that something new and works
Yeah.
with the teething toy. So a mashed, whatever you want to introduce the child to. So
Mm-hmm.
that is something else. So an interesting thing that even I came across recently is a ball with a silver spoon kind of came with this. Apparently, the Greeks used to use a silver spoon, a frozen silver spoon, for the newborn children to soothe them.
Oh, okay.
Yeah, even that was something new to me, which I read up somewhere. So basically, you can freeze your spoons because they won't hurt them. If there's anything that's roundish, basically the child has to soothe it here.
Mm-hmm.
So recommended is anything cold.
Okay. Okay.
Best is because at that age kids either they do it themselves, or the best thing is when the child is sleeping, the parent can just put a frozen gauze or something, and keep it in the
Mm-hmm.
child's gum, just
Mom.
rub it
Okay.
there.
So how about allopathic or homeopathic medicine? What is your opinion about them?
I personally do not recommend, and they shouldn't be given because teething time can vary from say 10 to 12 days and to, like I said, to even 20 days. How
Mm-hmm.
long are we going to medicate the child?
Yeah.
Also, but there are certain very, very severe cases. So in that case, you can apply the allopathic ones, but now there are again a lot of anesthetic agents which are available in the allopathic
Mm-hmm.
gels, because nothing should be given as a medicine, as a tablet, but a gel. it's not very useful because the child is going to be drooling excessively. It's going to come out before we know it. But still, but again, now in an allopathic, the things that we can give is an anesthetic agent containing lignocaine.
Mm-hmm.
That is still safe because that's an agent which you should always read on the tube of the gel. But
Okay.
never ever give an agent that contains a tube that contains benzocaine agent. It is almost banned, but there are still over the counter gels, medicines which are available and they're sold as teething gels, but they
Mm-hmm.
should never give in because it's like quite a life threatening thing. They cause something called as methemoglobinemia,
Mm-hmm.
which basically reduces the blood's capacity of carrying oxygen and can be
Mm-hmm.
quite deadly. There are cases when the kids, have kind of stopped breathing, and a lot of things happen. In some cases, they happen just by one use. Some happen over
Yeah.
some use of some
Mm-hmm.
days, but they should absolutely not. They are officially banned, but you still get them.
Okay.
Coming to homeopathic, no, I wouldn't recommend them because there is no strong research for
Mm-hmm.
that again. And how they act on the body is not really proven. And they claim that the homeopathic medicines will act on multiple things. They claim to reduce the pain, they claim to
Yeah.
reduce the drooling, but the way they do that is by acting on the body. The way they reduce
Okay.
the drooling is by acting on the thyroid gland of that little kid. So
Mm-hmm.
I wouldn't recommend any of it because they are not really proven. Yeah.
So, I once bought this teething necklace and a bracelet, which I
Hmm.
later returned. So, what do you
Yeah.
think about them? Are they safe to use?
No, they are not safe to use. In fact, they are quite risky for a child for multiple reasons. Is one is there are cases when the children have strangulated themselves, cases when the children have broken them and kind of taken the beads inside. So one is
Yeah.
most importantly for that reason they're not safe. And secondly, the way they act. What I was just telling you, the way they act is usually by the amber thing. It acts because of the body's temperature of the child. It releases a substance which gets
Mm-hmm.
absorbed in the body, which acts on the pain receptors in the body, reduces the pain of the child. At the same time, it
Okay.
acts on the thyroid gland, helps you
Mm-hmm.
reduce the drooling. So parents
Okay.
are very happy that these things act on the child, and the child is super comfortable, starts eating. But if you think of it, the way they act, they're not safe. But most importantly, strangulation and swallowing the beads, the cases have been reported of that.
Mm-hmm.
So no,
Okay.
no.
Yeah, so it's good actually that I returned them.
Yeah, yeah, absolutely.
Yeah, so when should parents, contact their doctors? I mean, in
uh,
the process of teething. Yeah.
if for about 7 to 10 days, I think parents should try using anything cold to soothe the child because that is the only solution to teething. And sadly, we cannot avoid it. If a child has to go through a bad teething phase, it has to go. So 7 to 10 days, parents can use the basic remedies. But if at all there's immense amount of bleeding that happens or swelling that
Yeah.
happens, maybe then they should visit a pediatric dentist. But the need to visit a pediatrician arises when the fever lasts for more than 7 days, the
Okay.
loose motions last for more than 7 days, because then that cannot be teething. There
Yeah.
possibly can be, an innate thing, like I said, because of the development, because of eating anything,
Mm-hmm.
child can develop a lot of other infections. So teething
Mm-hmm.
cannot give you anything like fever or loose stools for more than 3 to 4 days. It should not.
Mm-hmm. Okay.
Also, there's a lot of rash that children get in teething,
Mm-hmm.
but that rash should be limited to the face because of the
Okay.
drooling.
Mm-hmm.
Parents should
Yeah.
visit a doctor, again a pediatrician, if the rash is
Yeah.
seen anywhere else on the body,
Okay.
because
Mm-hmm.
drooling will not go beyond this much area of your face at all.
Okay. Mm-hmm.
Any effect.
So, in your opinion, how should parents, care for their when their baby, starts teething and they have their new teeth coming up, like in terms of instilling, oral hygiene or, brushing and other things?
Yeah, so there is one, I mean, it's not very new, but there are these teething toothbrushes,
Mm-hmm.
which also they sell as teething toys, which can be a very, very good thing for the kids because anyway they start chewing on things. So at the same
Yeah.
time, while doing that, parents can freeze that. They can put it in their finger, start rubbing it on the child's gums. So it
Mm-hmm.
kind of works for the child to soothe them, kind of gets the child used to something like a brush, because once the tooth erupts, we always advise the parents to start the cleaning of the oral
Mm-hmm.
cavity of the tongue.
Yeah.
So
Mm-hmm.
till then the parents don't clean the tongue, but once they start having anything other than breast milk, it's necessary to start cleaning their tongue. So that's how you can instill it, basically by That is why best thing is to have a gauze on your finger or a toothbrush,
Yeah.
because they then realize that the parent is going to put something and that makes them feel better, a
Mm-hmm.
positive way, because it calms the child. Anything cold will calm the child. For a child who's getting the first tooth, the only thing that I would recommend is immediately after consumption of anything, use a gauze and clean the tooth,
Okay.
and
Mm-hmm.
slowly advance to the finger brushes, not
Okay.
anywhere else. Yeah.
Yeah,
Yeah.
and so I guess like those were all our questions, and we got a lot of information about teething in babies, and it was really, really good to have you.
Thank
Thank
you.
you for joining us.
Thank you so much.
Yeah. If you like our videos, do subscribe to our YouTube channel, Quick Mommy Hacks, and follow us on Instagram for some personal tips on pregnancy, childbirth, and motherhood. And do leave your feedback and comments. We would love to hear from you.